This project, as part of the La Trobe University Masters of Podiatric Practice placement, is the result of the Eastern Health Podiatry Department requesting the development of a pressure care device resource due to the high prevalence of foot and ankle pressure injuries.
Despite general consensus that pressure injuries are preventable, they continue to pose significant problems for the Australian healthcare system. For instance, in the third Pressure Ulcer Point Prevalence Survey, Victoria's statewide prevalence for pressure injuries was found to be 17.6%. Pressure injuries subject patients to both psychological and physical suffering, such as reduced quality of life and, in extreme cases, mortality. They extract a high cost for the healthcare system, with the median cost being $285 million nationally. Furthermore, the prevention of pressure injuries is believed to be 2.5 times more economical than treatment. Thus, goals should be directed towards prevention. In order to achieve pressure injury prevention and reduction goals, clinicians should be able to appropriately select pressure care devices based on risk assessment. However, this is neglected for the following reasons. 1. The challenges of hospital environments. 2. Time constraints. 3. New devices are currently being marketed. 4. Pressure injuries are complicated and multifactorial. And 5. The selection of a device is often a patient-dependent, such as patient comfort and compliance. This is concerning as the appropriate selection of a pressure care device based on risk assessment often demonstrates the concurrence of wound knowledge, critical thinking, and care skills. For example, Jones, Berger, Pirano, and Utley found that the key factor in decreasing skin breakdown was nursing staff education, with ongoing reinforcement. Therefore, the main influence for the development of this quality improvement project is to reduce the gap in knowledge regarding pressure care device selection.
The aim of this project was to explore and implement a sustainable online resource to improve the level of knowledge of staff and students to appropriately select pressure care devices based on risk assessment, the Braden scale, at Eastern Health. The objectives of this project are specific: to develop, evaluate and implement an educational website for increasing and retaining knowledge regarding the costs, indications, contraindications and supplies of pressure care devices currently being used at Eastern Health. They are measurable, so by contacting a sample from the target population via face-to-face and email to complete a short evaluation via SurveyMonkey. They are achievable. The website will be applied for 1 month, and based on the survey results, we will determine the possibility of implementing the resource in the long term. They are relevant, so the website is designed to ensure that knowledge of pressure care devices is increased and to retain, as pressure injuries are a current problem at Eastern Health. And finally, they are to be achieved within a time period from the 10th of July until the 31st of October 2015.
In order to ensure that the identified aims and objectives were achieved, several processes were used. The identified project tasks were divided into 4 phases: planning, scheduling, implementation, and outcome. During the first project phase, the project team collaborated with the project supervisor at the pre-commencement meeting in order to clarify what the actual problem was and what practical outcomes were required to address it. This also required us as a team to liaise with relevant organisations and stakeholders via email and face-to-face meetings to obtain any resources and readings that would enable project scoping to begin. From this meeting, the aims and objectives were developed and a project proposal was submitted, incorporating a schedule of project tasks and impending deliverables. Once approval was obtained, key stakeholders were established to oversee project tasks and assist in establishing the final outcomes of the project. During the scheduling and defining phase, in order to achieve the aims and objectives as agreed upon in the previous phase of planning, several practical tasks were required to be undertaken. This involved contacting the pressure care device suppliers provided at the preliminary meeting to confirm and identify which devices are currently being used across Eastern Health, contacting the project supervisor and supply companies to determine the cost and supply details of each device, performing a literature review to identify the contraindications and indications of the devices. Additionally, this involved consulting with Eastern Health staff and reviewing the manufacturer's guidelines, then synthesizing new evidence into clinical recommendations and algorithms, developing a draft online resource detailing the costs, indications, contraindications, and supplies of each device, contacting a sample from the target population to complete a short evaluation by a survey monkey, and then modifying the online resource based on the feedback obtained, and finally, assessing the possibility of implementing the survey and the resource in the long term. From here, once the aforementioned tasks were known, time needed to devote to each task could be decided, and ethical issues and constraints could be identified. Identifying these allowed the project team to realize that the project as scoped was cost efficient, did not pose any risk, was time realistic, and was ethically suitable. By the end of this phase, using the feedback obtained from key stakeholders, the project plan could be finalized. Throughout the implementation phase, we continued to negotiate with stakeholders to implement the project strategies and tasks. In addition, the following processes were implemented and achieved. We conducted and collated background information into current pressure care devices being utilised at Eastern Health. We liaised with current Eastern Health podiatrists to gather further information on needs and outcomes, and we constructed a draft website resource and implemented a short survey as part of our short-term evaluation. Finally, using the information gathered in the previous project phases, an online educational website was developed. This educational resource was developed to assist in increasing awareness of available pressure offloading devices and their indications for use amongst healthcare professionals throughout Eastern Health. More specifically, the website seeks to improve the knowledge and selection of pressure care devices and thus optimize management of pressure injuries, promote prevention of pressure injuries, and provide optimal care to patients at risk of or with existing pressure injuries. The website was produced in accordance to the needs highlighted in discussions with key stakeholders, the project supervisors, and the relevant organisations, as well as the feedback obtained from the online survey. Once finalised, the website was provided to the project supervisor for appropriate distribution.
In October 2015, the project team finalised a 10-question survey to gain clarity about how we can improve the overall project in the short term. In total, 60 surveys were sent out via email or Facebook post. Of those who received this information, 48% of the respondents first heard about the website from a work colleague, and 16% of respondents found out about the website from advertising in the workplace. The other 36% identified other. We collected and aggregated the survey results for 25 respondents. This represents a response rate of 41.66%. Despite allowing for the risk of a low response rate, for instance making the survey short and easy to understand, the response rate remained lower than preferred. Additionally, while it was not feasible to administer the surveys using statistically valid sampling techniques due to the limited time and resources, the survey results provided data on short-term outcomes for those surveyed. The 10 survey questions included information regarding the quality of the website, how the survey meets the needs of the audience, time between visits, if the website will positively impact health professionals, and other information to improve the overall website. 4% of respondents visited the website about once a week, whereas 96% of respondents visited the website for the first time, indicating they received the survey email or directly heard about the website from a work colleague. The group members noticed that challenges were encountered with verifying which health professionals were completing the survey. Although only 36% of respondents indicated that they were somewhat likely to recommend this website, of those, an overwhelming 64% of respondents indicated that they were very likely to recommend the website. For the same question, 52% stated that they are somewhat likely to return to the website, and 40% were very likely, with only 4% somewhat likely or not likely to return at all. This helped identify any limitations with accessing the internet at all times, particularly when working or for those treating inpatients on the wards. Respondents, 72% identified that the website was of good quality, and 28% stated that the website is of excellent quality, indicating minor need for quality improvement. However, this is an aspect of the website that does require improving over time and can be reassessed during the long-term evaluation process. Overall, the website is visually appealing, as shown by 64% of respondents, and is extremely appealing to 12% of respondents. However, another 12% of respondents stated that the website is moderately appealing, and 4% found it not so appealing. Others, 8%, found that some areas could be improved by fixing bulky text and improving photos. such as removing the photo of a dentist, as this was not relevant to podiatry. The results showed that the website is helpful in selecting the most appropriate pressure care device. This is specifically evident in question 5, as nearly all, 96% of respondents stated that the website will have a positive impact on health professionals and subsequently patients. However, while the project yielded some success, the survey data results suggest that the project has limitations with the audience's ability to understand the information of the website, despite 83.33% of those finding the website intellectually stimulating. 62.5% of respondents stated that the website met their overall learning needs very well. This may correlate to the 41.67% of respondents who found it extremely easy to understand the information on the website, with 20.83% of those which recorded it as very easy, and a disappointing 12.5% finding it moderately easy. These results are possibly an outcome of the poor grammar and spelling mistakes, which were also suggested in question 10, such as grammar in the website needs minor adjusting. On the home page, the numbered comprehensive summary could be edited. The first word on each dot point could be cut out. At the end of this presentation, we will be clicking on the website link to show you our website.
Various limitations emerged during the project, which were professionally managed by the project team in collaboration with the supervisor to enable effective implementation of the project. As part of the short-term evaluation, we initially aimed for a 60 multiple-choice questionnaire to be completed. However, due to the time constraints and complexity of the questionnaire, this was reconsidered. This was overcome by considering and implementing a short, simpler multiple-choice survey. Unfortunately, as the project is on a strict time limit, we are unable to complete the short-term feedback to the level that we would have liked. However, if Eastern Health decide that the project has been a success and want to further implement their website, they can further the feedback and review the larger sample size and disciplines. Another limitation that was found was the scope of the project and depth that we were trying to achieve. Again, this was refined and put back on track by following the project processes and initial Gantt chart set out.
The knowledge that we have gained throughout this project has enabled us to make a number of recommendations for Eastern Health regarding the permanent implementation of this resource. To promote awareness of the pressure care resource through various outlets such as emails or posters. To open access of the website to all health disciplines and all patients of Eastern Health. Adding videos to the resource which demonstrate how to apply and use pressure care devices. This ensures that devices will be applied and used appropriately, reducing pressure in high pressure areas for patients correctly, and will overall reduce incidence of pressure injuries at Eastern Health. Continue to update the website if devices used by Eastern Health change, to ensure this information is up to date and can be used at any time by any health professional. Professional development opportunities provided to podiatrists which focus solely on managing pressure injuries and devices which can be used. This means podiatrists are able to further their knowledge base and understanding on pressure injuries and pressure relieving devices. Make available to all staff at Eastern Health. This ensures that podiatry is not the only department which have the adequate knowledge of pressure care devices, and all staff are able to identify when patients are at risk of developing a pressure injury and are able to implement appropriate device confidently. Eastern Health should also undertake a long-term evaluation to ensure that the website is being used by health professionals. Additionally, they should consider analysing the incidence of pressure injuries prior to the implementation of the resource, as well as post-implementation, to evaluate the effectiveness of the website to clinical practice.